Thank you, Dr. Shantanu, for your nice presentation. Now I would like to invite Dr. Sayeef Mark, ex-consultant of Queen Elizabeth Hospital, UK. His topic is artificial intelligence, threat or blessing. Thank you.
Look at the current era from 2000 until now, there has been some astonishing innovations like the Watson, that question answering system owned against the human participants in a TV show. And also we can see the program AI assisted care is now being used for the elderly people care as well as for the ICU patients. So it has also extended its project over the hand hygiene system and is quite useful for the nursing staffs and also for the doctors to prevent the hospital-acquired infection in patients. And we all know about Fitbit, Apple and other health trackers are now being used to monitor the heart rate, activity levels, sleep levels and even ECG tracings. So some of the developed countries like Netherlands are now using this artificial intelligence to detect mistakes as well as workflow inefficiencies. And we all know about Siri, Google Now and as Voice. They are all working, allowing patients to seek care earlier. So there are two main branches, one is virtual and one is physical. The virtual one and the physical branch mainly includes the robots. We know that the robots are quite useful in conditions like rehabilitation and also delivering of drugs to target organs, tissues and tumor. So we can see that the artificial intelligence have been quite useful in the different aspects of the healthcare. So if we look at some of the systems, for instance in cardiology, it has been used to detect the atrial fibrillation and some of the apps are now already using it and it has been shown that it's more effective than the routine care. And also it has been used to interpret the lung function test and it's more effective than the routine one. And endocrinology, it has been a revolution for the continuous glucose monitoring as well as to detect the hypoglycemia. So in the gastroenterology, there has been the diagnosis of some conditions like the colonic polyps, atrophic gastritis and GERD as we discovered in November 2022 and it has quickly gathered attention for its detailed response as well as articulate answers. But we don't know that where it will go, so it's a major concern for all of us. So there has been some challenges of artificial intelligence in medicine. One of them is the validation of the core concepts, because there has been some comparing the efficiency of artificial intelligence versus clinicians, but most of those studies have been quite limited. And also there has been question about the designs as well as sample size, as well as there is association of some selection and spectrum bias as well. And also there is concern about the ethical implications of the ongoing monitoring, because there is some violations of privacy through internet for the patients. And also there is a concern that whether the ill or chronically ill patients would be able to adopt the new health system and whether they would be penalized due to this lack of adaptation. So there is a major concern for all of us that sometimes the new health system will be running. So some of the universities have already created some curriculum to answer to those educating future medical leaders for the challenges. And those augmented doctors would count on both their clinical experience as well as digital expertise to solve the modern health problems. So the concern is that whether we are going towards the dehumanization by the technology, because there is a major concern that the physicians are having some burnout issues.